Hello and welcome to the Myelin Institute at Queen Mary University of London. Welcome to another in our series of videos on the COVID-19 crisis. Today we're going to be hearing once again from my esteemed colleague Professor Sophie Harman, who's going to be talking about President Biden's new COVID-19 task force. If you enjoy this video, please do tell others about it and please sign up to our mailing list on our website.
Joe Biden is President-elect of the United States, and he is a man with a plan to deal with coronavirus, both domestically and internationally. So what does this actually mean, and what lies ahead for Biden in the coming year in responding to COVID-19? Well, first off, throughout the campaign trail, Biden has been very clear that he will be led by the science and public health. And in his very first announcement since becoming president-elect has been to launch not only his plan, but the task force for coronavirus in the US. Now, this is really important because he's not just saying, I'm going to be led by the scientists. He's also saying, here they are. This is transparent. You can see who is feeding into my decision making. Now, the problem here is, of course, we should all be a little bit relieved that we are now being led by the science. We need scientific experts in the response to COVID-19. But that does not exclude the role of politics, particularly in the US. If you look at Biden's transition plan on COVID-19, it is very explicit in what he wants to do. And some of that is absolutely going to rely on bipartisan support in Congress. So he is going to have to put to work his kind of reputation for crossing the aisle, for working with other members of the Republican Party to try and build support across the US for very specific parts of the plan, such as making mask wearing mandatory, extra budgetary support for schools, those kind of issues that require and demand involvement of the whole of US government, not just the White House. Now, another way in which he's going to do this is by very much evoking a war effort spirit. Throughout his transition plan for COVID-19, there is the rhetoric of this is really a war effort. It's politics by other means. So those of you who've watched early videos on global health security, you know that the whole idea of evoking the issue of a security threat is to say this is something else than normal politics. Now, this is clever because not only is he suggesting that we need to have an effort across government, therefore get behind me, he's also saying to the public, we also need you to do your part, play your role. So you can see this in him evoking Roosevelt, saying, look what happened during the war. We mobilised our industries. We can do the same when we're trying to roll out test and trace. Also, this provision of PPE as well and all supplies and equipment. It's like, let's use the whole of the US government, including the role of the defence sector. Now, this is really interesting because he's saying, right, straight up, this is a war effort. We need to all get involved. However, we have to have some caution here, particularly in regards to another part of his plan. This is being led by the Vice President-elect Kamala Harris and her task force on, let me get this right, Racial and Ethnic Disparities Task Force. Now, this is hugely important around the world as we see racial and ethnic differences in people being infected and dying from COVID-19. But in the context of Black Lives Matter and in the aftermath of George Floyd, this is crucial that they've set up this task force. Now, what has this got to do with the war effort rhetoric? Now, some of you may remember from, again, an earlier video, that sometimes when you link health with security, it evokes certain actors, so security actors, military actors, that in the context of the US with Black Lives Matter may come against some of these kind of issues around racial tensions and attitudes towards the police and security enforcement. So what's going to be very difficult here is making sure that this role of the war effort, security, defence doesn't then encroach onto penalising citizens or citizens feeling like they're being controlled by military forces. If it errs into that way, so we start to see military enforcement rather than provision, or security sector enforcement rather than provision, and you could argue we're already seeing that, so what's the point? But more of that, this is going to really undermine the role of the task force that Harris has set up. So what's going to be really interesting is how we see this balance then between this war effort and also this racial and ethnic disparities task force, and how they don't contradict each other in effect or lead to tensions with each other. But the headline news is, okay, Led by the science, putting that into practice by announcing the task force, the real need for not just science but effective political coordination and cooperation across the aisle, getting Congress behind the plan in itself, which is not going to be easy, let's face it. This huge war effort, this is politics beyond other means. We're going to evoke this kind of Roosevelt kind of leadership. And then again, how this does not undermine the role of the Racial and Ethnic Disparities Task Force, or if that gets a kind of second level of importance. So this is the US. So things are looking positive. We see this action, it's happening. But what about at the global level? What's this going to mean for global health security? Now, on Saturday, I imagine you could have heard the huge relief coming out of Geneva from the World Health Organization, as Biden has committed to the US being an active member of the WHO and to reverse Donald Trump's commitment to withdrawing from the organization. Now, this exhale is short-lived. The WHO should not rest on its laurels and think it's going to have an easy go within the Biden administration. Biden admits the WHO is not perfect, but is necessary. However, the WHO really needs to get its act together in terms of transparency, its relationship with China. It is going to have questions to answer on that. What we see, though, in global health security is a real reset to 2016. So to the Obama years of putting global health security and biodefense at the centre of the White House. So Biden has committed to re-establishing the Directorate for Global Health Security and Biodefense as a priority. He wants to extend the powers of the Centres for Disease Control, and he quotes for it to be its eyes and ears in specific countries, including Beijing. Now, really notable that he mentioned Beijing in that respect, given this kind of origins of coronavirus and, again, the relationship between the WHO and China. The questions we've also got to ask, though, is how are the US going to position themselves in these new institutions that have come up since COVID-19 first came about? These institutions are really related to vaccine development. So we know that the US government has committed funds to CEPI, which is around vaccine preparedness, so sharing vaccine ideas, investing money into getting a vaccine. The other one, though, that's very interesting is this organisation called COVAX. So COVAX is about ensuring that vaccines are available for everyone throughout the world. As you remember, global health security rests on everybody being vulnerable. So therefore, we need to get the vaccine out into other countries. COVAX has been established to allow that to happen, to ensure vaccines go to lower middle income countries that can't necessarily afford it, or vaccines go to those states that aren't just the ones that have invested in it. So far, we've seen little commitment from the US government to COVAX, but we should see some change from the Biden administration. So in one respect, you do see a reset to 2016. You see the US government saying that, okay, we are going to commit to multilateralism. We're going to involve ourselves within these institutions of global health and really show a leadership role. However, I do not think this is the end of America First. It's the end of Trump's version of America First. But what you're seeing is a kind of two-track. You're seeing the US reinvest with multilateral institutions, really kind of investing its role and its leadership in there, but it's strengthening its own bilateral global health security mechanisms through upping its involvement with CDC and setting up these kind of bilateral task forces as well. So Biden, president-elect, here comes his war effort. Let's see if he can do it.